the first reaction of most people when they see a obese person, they would say, okay, you must be just eating, and it's your problem. You're not taking care of yourself, without realizing that there are hundreds of factors which are into play. I feel personally that we should wait for a little bit more time, get more data on the drug before we can start prescribing, because we are now receiving horrendous kind of adverse effects from these drugs. So, Bahua, what's when I went abroad, I found that there was a basic difference between our training and the training abroad. What we lacked in our training was how to handle how to have the bedside manners and things like that.
Hi, in today's episode, we have with us Saurabh Mishra, Senior Consultant and Head Gastrointestinal and Bariatric Surgery, Apollo Hospital. So just to tell you a little bit about Saurabh Mishra, he's a Senior Consultant, as I just said, and he has extensive experience since January 1999. He's performed over 10,000 minimal access and 100 robotic surgeries, including advanced gastrointestinal, bariatric, and complex hernia procedures. Dr. Saurabh is an esteemed examiner and central observer for National Board of Examinations, New Delhi. He serves as the executive committee of the Hernia Society of India and is a faculty member for various prestigious organizations, including IAGES, Obesity Society of India, and Medtronics India. But today we are not going to talk about all his medical experiences, but we're going to concentrate about the author in Dr. Saurabh Mishra. He's authored the best-selling book called Incisions. So welcome, Saurabh Mishra, in today's episode. So Dr. Saurabh, to begin with, what's the key motivation for you to write this book, and what was the primary and secondary beneficiaries of your labor of work?
Thank you, Mohua, for the nice, kind words. And thank you for having me on the show. It all started in 2019. We were seeing a spate of violence against doctors. And 2019, there were at least about 1,000 cases reported India-wide, and it was only rising. Then there was a report by IMA which said that there were about 75% of doctors had faced some sort of violence against them at certain point of their time. So we sat together and we thought, let us introspect what exactly is going on, what's happening to the relationship, which always have been pristine all throughout my career. But this was a new low. So that formed the basis of my work here. We try to understand what went wrong and what are steps we could take to rectify it.
Without talking only about, all of that, I really want to know a little bit about the title of your book. You called it Incisions. It's such a crazy wordplay. So how did you go about choosing the title of your book?
Well, what are the incisions? Basically are the first cut that the surgeon makes to enter the abdomen or any part of the body to get things right deeper down. And this was exactly what we wanted to do in our book. Make an incision, get inside the problem, try to understand what is the new age patient desires from a doctor and how can we deliver it better to everyone. Also, we wanted to know how to help the patients get the best out of the doctors. So this was the basis of the of a title.
So can you just share with our listeners, the highlights of your long and illustrious career and the key inflection points and decisions that made you who you are today? Who's Dr. Saurabh Mishra? Tell us a little bit more about that.
I'm a very small town boy. I started my career in Ajmer. I was born there. I did my MBBS there. And then not much was happening in medical terms those days. And then I moved on to Udaipur, did my MS general surgery. And then the thing was that we were in a medical college. Not much was done except the basic surgeries. But frankly, I felt that I had much more to learn. So I left everything and went to Delhi. I think Delhi was the place where a lot of things were happening, and especially in terms of minimal access surgery. And I found just the right place, and I got a job in Sir Gangaram Hospital, which was actually the hub of all minimal access surgery happening all over India. And I was lucky enough to be working with the best of the people who were also in their learning phase. So we learned together. Having finished it, I came out and I was trying to search for something even higher. So I got accepted as a fellow in Mayo Clinic in US. Spent about a year there, going doing my fellowship in bariatric surgery, and came back and joined Apollo. And that's how I have been with Apollo for almost 21 years now.
Yeah, it's a really long time that you've been here now. No?
Yes, yes, it is.
So, just, you speak about helping your resident doctors metamorphosize. It's a very big word, right? And, you speak about developing connect with, your patients, which I will vouch for because I've been your patient and, here we are doing a podcast together. So how do you handle, helping your resident doctors to adapt to this trait in which, you're considered quite an opinion, a maker of a distinguished person in this field. You're known to, build equations with all your patients. So how do you go about teaching them these soft skills?
So, Bahua, what's when I went abroad, I found that there was a basic difference between our training and the training abroad. What we lacked in our training was how to handle how to have the bedside manners and things like that. So the soft skill part of the surgery is extremely important, or in fact, as important as the surgery itself. As young as young students who join with me, we divide our training into two parts. The one is the surgical skill part. Now that would anyone would do, and these people who are extremely bright would take up these skills faster than the other people. But what we can make uniform is how the people skills. So what we
Mhm.
make sure that they connect with the patients, and when they talk to the patient, they listen to the patients. That's where the empathy comes in. So when you empathize with your patient, you are going to give them the treatment what the patient deserves, and not what's written in the book. That particular thing makes a difference between an ordinary surgeon and a great surgeon.
That's such a wonderful thing.
Yeah, so all my residents, I tell them to look at these patients as your relatives. Now, would you do the same surgery on your father, mother, brother, or sister, or anyone related to you? Or how would you manage them? How would you talk to them if suppose you have some complications happen? So that's how you actually imbibe the culture of empathy.
Not easy.
Yeah.
It's not easy at all because it requires you to really, delve really deep down, and not everybody can be empathetic. Do you agree with me, Saurabh?
Yeah, I think, Mahua, not everyone can be, but with the teaching, and constantly it's been hammered down that do you listen to your patients or not? So did you hear him? Did you hear him talk? And I stand there, listen to how these young surgeons would interact with the patients. And believe me, it makes a difference when I tell them, see, this is what not you shouldn't have spoken, and this is how you should have dealt with the patient better. You should have asked for permission before you touch them. So these are the very tiny little things which makes a huge difference between a consultant who is just a consultant, and the other people. You might not do a huge amount of surgeries, but that doesn't make you a lesser surgeon if you are empathetic towards your patients.
Absolutely. So let's just talk a little bit about the corporatization of modern healthcare. How has it impacted the patient and surgeon relationship?
Yeah, I think it's impacted at three levels. So some very good, some very not very good, and some really awful. So what's happened is that let's talk about some things which were good. What has happened is that a lot of money has come in. So with the money flowing in, You get a better equipment, you get better quality of care, you get better hospitals, better smelling hospitals, better trained nurses, trained doctors, getting trained in US or anywhere else and coming back to India to serve the people. Now that's a good part of it. But the other part, what has happened is that it's turned the patients into consumers.
Yeah.
So once the consumer thing comes in, a lot of the dynamics of the patient doctor relationships change. What happens is that now the patients demand. I have been serving in the part in the past where my word was the last word. It was a hierarchical situation in which I would tell my patients, okay, this is what it is, and the patient would agree with it. But today the patient does not. Patient has got a huge amount of information through the net. uh, he can, from a click of button, he can have another appointment with another doctor and get another opinion. And then there is, what happens is, when you have that kind of situation, doctors also get scared. Instead of upping their skill levels, trying to talk to the patients more, what they will do is they will try to have defensive medications. So you'll have more investigations, you'll have uh, drugs which may not be required but possibly fall into that gray area. And then there is a serious issue of monetization. So
Yes.
the cost of getting treated has gone over the roof, and that is where a lot of these violent incidents have happened, because patients have come back and thinking that they will get out, when they pay up, they will get the treatment which is out of the world, which is basically a little offish, because you see, when the plan does not go according to the patient, it gets they get really frustrated, and that's
Yeah.
where the problem starts.
So, how do you think inpatients should be more, aware in taking better decisions? I think for our listeners, this will be really helpful coming from you.
I think now we're talking about an era where a huge amount of internet is there, and so first step is to understand your problem.
Okay.
Understanding your problem means that you have to go to the net. Don't think about what the doctor or the GP has told you. He may not be aware of things which are there. So you go to a website which is accredited. You go to a Mayo Clinic website, or you go to a Cleveland Clinic website, or you go to Apollo Hospital website. You are unlikely to have the wrong information. So that's the first part of it.
Okay.
Then you need to have a long conversation with the surgeon you have zeroed on, or as
Mhm.
doctors you have zeroed on. Ask questions. Ask as many questions as you can, because it's your body you are talking about.
Absolutely.
You're giving a right to another person to treat you. So that means you should have full confidence. And then the third part, which is extremely important, is get second opinion.
Hmm.
So if two or three doctors tell you the same thing, then most likely the opinion for the first doctor is right. But what's happening is that the medical science is growing at a very, very fast rate. And one surgeon may be skilled in one thing, the other surgeons may not be skilled in the same. You may like to have the best. And then, so second opinion will get that thing into picture. And then take an opinion. Then take a decision based on whatever the opinions you have.
You also speak about the algorithm, to help choose the surgeon. So, can you just explain a little bit for the benefit of our listeners?
I think that there are the two parts of it. So first part is why. Why should you have that kind of algorithm? So
Yeah.
2019, my father had an MI. Now I'm in the hospital where you have 14 cardiologists. How do I choose a cardiologist? On what basis should I use? I had an option of having a cardiologist friend of mine who's very close to me, and then another cardiologist who is just retired from a very big institute, and he's also a good guy. So both of them, it was a difficult decision, because frankly, I can only understand what they would like to do, but I don't know about the skill levels because I've never been into the cath lab. I really can't look into. I am in the board. I can only understand if the patient complains and the complaint comes to the board. So then
Okay.
only I can understand that. So if it can happen to me, what about a person who has just been got into the emergency, how would they choose? So that brought me to a question: why not produce an algorithm by which everyone could go and decide what to do in these circumstances? So there are various parameters in our algorithm which gives points to credibility of each of these inputs, like what would happen if someone else had an accident or anything. People would put out their phones and then look into what has happened, what the surgeon says is the right thing to do, and then the practo picks it up, it pushes a name, and there you see a lot of likes. So it would be very difficult, because this is the scenario in which, your mind is working, your mind is not very focused on what to do. You have so many things to monetary part of it. He is not in a bad shape, good shape, and then you have to decide what to do. So a lot of things are happening. So we developed this algorithm to kind of remove all the noise and get you to give points based on uh, the quality of the input. Like, if suppose it's a word of mouth, it gets the highest ranks, so it gets 4 points. Now, if it's something like likes on the internet, it gets 2 points. It's okay. But if it's a video testimonial, it gets a higher. Then you
Yeah.
then you come down to how the doctor looks like. Is he looking, is he empathetic towards you? So all these points have been put together in 10 point, a small algorithm which you can rate, and then rate the surgeon, and then finally go according to what you want to do. The end result may not be different, but you have done your homework, and you will be able to accept whatever comes out of it much, much better.
Of late, on social media, one sees a lot of these really, frightening things where patients come ahead and they attack doctors. And I've been reading so much about it, So there's been so many conflicts, between doctors, patients, attendants. How does one, deal with situations like this, Dr. Saurabh?
Yeah, I think what's happening is that let's get to the root of the problem. The root of the problem is there is absolutely a failure of uh, the government healthcare services.
Yes.
So the government healthcare services, which was very evident at the time of COVID,
Yes.
and government had to take over all the private hospitals to make sure that at least the basic treatment was given to everyone. India spends just about 1.2% of its GDP on healthcare, which is extremely low. The other compared to the other countries, which a developed country would actually spend something like about 6%. At least 3% is just acceptable, but 1.2 is extremely low. So what's happened is that when you don't get the treatment, and you don't get the empathy, and you don't get the right treatment which you deserve in a government hospital, it pushes you to more expensive alternates. And when the things don't go accordingly, and you've already spent, and there are a lot of people who have sold everything and come, and they are in debt, and that triggers anger reaction. This has been very well established that this is what starts the problem, and then it goes on, and then one trigger leads to another, and then there is an argument which leads to physical assaults and things like that. It's highlighted. Doctors on their part become more defensive in terms that uh, we are being attacked, and we are not being taken care of by the police and things. But it's basically at the ground level, we need to get the act. Only the government institutions can do it, so that these kind of incidents don't happen.
So, Dr. Saurabh, as a medical professional, were you able to discover your ikigai? And what was the path to really getting into this calling of yours? And how did you go about it?
Yeah, I was lucky. Like I said, I was when I finished my masters, like in Udaipur. The laparoscopic surgery or minimal access surgery was just coming up, and you won't believe that we actually went into a bus, the whole lot of us, to see one laparoscopic surgery. It was that rare at that
Oh,
time.
wow.
Yeah. And then when I came to Delhi and into Gangaram Hospital, where tons of laparoscopic surgery was being uh, happening, and then within a month or so, I was doing it myself. And wow, I have never looked back after that, because it was what I wanted. It gave me the kick, and not many laparoscopic surgeons were there at that point of time. So we
Okay.
really did it well. And then the second thing came when I went to the Mayo Clinic and saw that we guys are good. So we compared ourselves to our counterparts in Mayo Clinic, and I was just looking at the surgeons there, and I found that yes, I mean, if we get the right equipment, the right place to work, I think we are at par with anyone in the world at this point of time.
Internationally.
Yes.
So, there are a lot of studies that talk today about lifestyle related diseases, like obesity, there is diabetes, and there are so many other things. And of course, bariatric surgeries can really help a lot of these patients, right? So, why you think people don't opt for it that easily and as reasonable option, for a set of patients? What is the fear associated with bariatric surgery? Are there a lot of people who are doing bariatric surgery? Is there a rise? What would you say?
Mahua, we've seen till 2019, we had seen a huge amount of increase in the bariatric surgery year on year in India, and still rising around the world. India subsequently starts seeing uh, a decline, and this was very surprising, considering the fact that India has become the diabetic capital of the world now. So what happens? One of the reasons why the bariatric surgery is still not very acceptable is, one is that it's expensive, and although it's a keyhole surgery, not many people can afford it, and the insurance companies have just started to cover the pediatric surgery as such. The second thing is that obesity itself is a very, very ill understood disease, because the first reaction of most people when they see a obese person, they would say, okay, you must be just eating, you know, and it's your
Mm,
problem. You're not taking care of yourself, without realizing that
correct.
there are hundreds of factors which are into play, and
Mhm.
making a person what he is. There's a set point which is not letting the person lose the weight. So it's a
Okay.
very, very scientifically studied, but very, very ill understood by the rest of doctor community. What's happened is that we don't get the referrals, and subsequently what has happened is there are certain drugs which are available right now, which are in experimental stage, but still
Yeah.
kind of work.
Heard a lot about Ozempic. That is like really taking the world, by storm, and everybody's talking about Ozempic. Tell a little bit about this to our listeners, if you could.
Yeah, so Ozempic is like a drug which would cause. It actually was a drug for diabetes, and
Okay.
it reduces your appetite, uh, and causes you to reduce weight. That's how it
Okay.
works. In India, it's still not approved, and but I think a lot of trials are going on at this point, where you will have a clearance by the DGCA very soon.
Okay.
The
Okay.
doses are higher. We are still studying it. In the West, what has happened is that because the obesity is an endemic, and it's reaching an epidemic situation, the FDA has approved it in a hurry, and really not been approved by the other countries as yet. Uh, I feel personally that we should wait for a little bit more time, get more data on the drug before we can start prescribing, because we are now receiving horrendous kind of adverse effects from these drugs. So let us wait for some time, and if it is there, it really has the safety profile that is advertised. I think it will change the way we look at obesity.
Thank you so much. Also, in your book, you've dedicated chapters to urologists, GI surgeons, gynecologists, but you assert that orthopedics are the happiest lot. Why is there a common consensus among doctors on this point? Why do you feel that orthopedics are, a happier set of doctors than the others?
I think the world would agree that orthopedics is a paying branch. So you see, they are paid the best. And the other thing is very important is that they see results. They see results, and it's a very satisfying to see your work translate into a result. And you see a person who was invalid and broken leg, or maybe a joint which has gone wrong, and you did a joint, and you can see the person coming back and really hugging you. I mean, this compared to, let's say, ER, where you get a lot of these patients who are very sick, you may or may not be able to save a few. Or maybe oncology, where about 50% of your patients may not make it. Or let's say nephrology, where kidney diseases would ultimately slowly and slowly kill most of them. So the orthopedics definitely pays more, and you have the results. So obviously they would be very, very happy. I think I think that goes for all the surgeons, orthopedic surgeons around the world. So we guys are at the middle somewhere.
Sometimes it's easier to be in the middle,
Yep.
Dr. Saurabh, than to be on, on either side of it, too hard or too happy.
Yes.
So let's talk a little bit about ailments such as cancer. This is a very serious disease, right? Treatments along with the mental well-being of the patient, they both go hand in hand. And so can you share a little bit of your perspective, with our listeners right now as to how about people go, how do they take this entire news when they hear that they've got a kidney disease that, ultimately will end up, not in the best way. Cancer, sometimes that may not be really fully curable ever. So in this entire healing journey, are there any critical things that they need to look into to make the path and the journey a little less arduous?
Starting when a person is told that he has a terminal illness, I think it
Yeah.
is shocking. It's the world just comes down crashing. And it's a very difficult thing, believe me, to tell them, and they break the news. Uh, Unfortunately, like I said, Indian health system does not teach the doctors how to break the news, how to console them, how to make sure that they take the news well. So what happens is immediately there is a grief reaction. So grief reaction, first of all, it would be that it's a disbelief, and then you will have anger. Then you start bargaining. Why it happened to me? What? How can I? And then you go into depression, and then you have the acceptance. So these are the stages of grief that a doctor has to understand and give the time to for the patients to digest them. From the patient perspective, we need to give them time. We need to tell them that there are um, alternatives available, and it's not so devastating as it would look at the first stage. So from the patient perspective, they have to teach it to teach themselves. So again, going back to the basics, they have to start researching, go to the website, find out which are the what is the actual problem they have. And the reason I'm saying is that not all cancers are terminal. There are now increasing list of cancers which are curable and curable permanently.
Oh, how
So
wonderful is that?
yes,
Which ones would that be, Dr. Saurabh?
so you have a huge amount of the cancers of the breast and thyroid and the prostate and um, bones. These cancers are basically treatable. Intestinal cancers, a lot of these intestinal cancers are like the gist, etc. Once you're done the surgery, a lot of colorectal cancers are now fully treatable. So we have patients who have about 20 years survival now. So that's a huge thing. We have newer drugs, we have newer radiation methods. A lot of brain tumors are now having increasing survivals. So we have to educate ourselves, then find the right guy to sort your things out. Do your research well, and then find another guy to talk about it. Means get a second opinion. So that will get everything into perspective, and you will find that you're on the right path.
So, as a hindsight, post your book, are there any topics you believe that you would have liked to cover that can be beneficial for your readers and patients in general? And maybe you would have left that out.
Oh yeah, I would probably take out an edition every year because see, medical science is constantly evolving. So which is true.
Yes.
about a year ago may not be relevant at this point of time. So I would like to do that. The second thing, one chapter I would like to put in, uh, which would dedicate to the etiquettes. Yeah, dedicates from the part of the surgeons and etiquettes in the part of the patient. So what it means when you are entering the doctor chamber, and how would you interact with them? What are the questions you need to ask? Is it right to get a video recording, or record the surgeon or a doctor? So it is okay to record, but then you have to take a consent.
Absolutely.
And so and don't take your phone calls when you are in consultation with the patient. Similarly, I'm not saying that all doctors are good. So you doctors have a habit of picking up phones and looking the other way, cutting them short, not listening properly, and giving them a very high-headed kind of a feeling. If the you know so that kind of a mismatch should not happen. You should take so that's where my part comes in, as a mentor to a lot of my surgeons. I try to make that, but I would definitely have included that in my book, maybe in the next few editions. If I have some time, I would definitely like to introduce that.
So I'm going to ask you a very, very selfish question right now, but also for my listeners. So if someone is experiencing gallbladder stones and fatty liver, what advice would you give them?
So, Baba, these two things are totally separate, So, the gallbladder disease, as such, if you go by the guidelines, you should not operate them till the time they actually start to pain. That's what is the traditional teaching. But over these years, what we have seen is that the laparoscopic surgery has cut down the morbidity and the suffering of the patient, and which would have otherwise come across if the person had severe pain or got into a complication. If you look at the benefit and the risk involved in the surgery, it is definitely more beneficial to go ahead and do the surgery earlier than wait for the complications to occur. So this is a new age thinking. The reason being that you may have a gallstone and you may be middle of your marriage, or you may be in the middle of your vacation abroad, and how difficult it is to manage pain and all this and treatment in a foreign country. It's very difficult. Or you may be expecting a child in between the pregnancy, and then you have pain, so we have to operate you, risking both the child and the mother. Now more and more gastroenterologists and the GI surgeons would prefer to operate earlier than later. And especially in high risk people like diabetes, hypertension, or people who have heart disease, we would like to operate them in an elective setting. Then we would see them in the emergencies where they would be, under severe cardiac medications. We would not be, the patients would not be optimized, or they would be on multiple antiplatelets where the bleeding would not stop if you operate on them. So that's one part of it. The other part is, you asked about the fatty liver. Now, fatty liver is kind of a genetic to Indians, and about 20-30% of Indians are suffering from fatty liver. It's more to do probably the diet that has changed over the years, and it's probably also the genes which are not agreeing to the diet, and obviously the lack of exercise, because we have been sitting in front of our computers more and more. So what happens if you have fat in your liver? The liver is the source of all energy. So the fat inside the liver causes inflammation, and the liver is not doing its job. Then by the end of the day, you'll feel extremely tired, listless. So these are the typical things what is going to happen with the fatty liver. A few of the fatty liver cases would go on to liver diseases, which would be like the cirrhosis and all that. But it's just about 12% of people would actually go that way. Most of them would suffer day-to-day issues, and the treatment is very simple: a little bit low fat in your diet. See, you don't Sweets is one you have to cut down heavily on and go for a walk. Just reduce a few kgs. That's it. And the work is done.
Oh, fantastic. It sounds so easy. And my last question, is there any non-surgical remedies, for gallbladder stones? A lot of people say, okay, you can wait and, maybe the stones are going to be broken down. It'll go, and what would be the early symptoms that one needs to detect, if one has these issues?
Uh, See, the gallbladder stones are formed because your gallbladder is not doing its job. So it's more or less kind of dysfunction. It's not completely uh, not functioning, but there is definitely a problem with the gallbladder itself. Secondly, the composition of your bile. So it is an interaction between a diseased gallbladder and a kind of a bile that you are secreting. Is a composition of that which forms gallstones. Now, suppose you have a drug which dissolves the stones, or in method something you want to keep the gallbladder, not remove it. What are the benefit you're going to get out of it? Is going to start forming the moment you stop the drug.
Yeah.
And the second thing is, the gallbladder is not an essential organ like the kidneys. So kidneys, if you have a stone, 100 times you will go and operate there and preserve the kidneys as much as possible. But gallbladders is not a very essential organ. If you remove it, it's not going to make a huge difference to your life. The only thing is that you'll stop having pain, and you are unlikely to have complications related to gallstones.
Okay.
So if you look at this, it's easier one-time treatment to go ahead with the surgery and get over with it, instead of taking medicines and trying to get onto the adjust to the complications, which are too many. So we reserve these drugs only for people who are inoperable or who are very sick to be operated. You have limited lifespan.
Fantastic. Thank you so much, Dr. Saurabh Mishra, for being on today's episode. We wish you all the best, and we need more books from you. And this, for our listeners, was Dr. Saurabh Mishra with his best-selling book called Incisions. Thank you for taking out the time and being on the show today.
Thank you, Mohua. Thank you so much for getting me here on the show.